guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering maternity. To be more specific, I'm going to be covering high-risk postpartum maternity. If you haven't done so already, please don't forget, go ahead, like and subscribe on this video. Share with friends that you know that probably struggling with maternity. I know a lot of students do. And without further ado, let's get into it. First question, a gestational diabetic client who delivered yesterday is currently on the postpartum unit. Which of the following statements is appropriate for the nurse to make at this time? 1, monitor your blood glucose 5 times a day until your 6-week checkup. 2, I'll teach you how to inject insulin before you are discharged. 3, daily exercise will help to prevent you from becoming diabetic in the future. Or 4, your baby should be assessed every 6 months for signs of juvenile diabetes. And I'll give you a moment to think of your answer. And the correct answer is 3. Daily exercise will help to prevent you from becoming diabetic. Women who have gestational diabetes are at higher risk for developing type 2 diabetes. So once that baby's born, baby's out of the womb, you have to teach mom about exercising, eating right, nutrition, right? To make sure that she does not become a diabetic. And if she does, it would be a type 2. Those women who have gestational diabetes are at high, not just any risk, not just a risk, they are at high risk for developing type 2 diabetes. Next question. A client who is 2 weeks postpartum calls her obstetrician nurse and states that she has a whitish discharge for 1 week, but today she's bleeding and saturating a pad about every half hour. Which of the following is an appropriate response by the nurse? 1, this is normal. You're starting to menstruate again. 2, you should stay on complete bed rest until the bleeding subsides. 3, pushing during a bowel movement can have loosened your stitches. 4, the physician should see you. Please come in whenever you are ready. And I'll give you a moment to think of your answer. Okay, the correct answer is 4, guys. First of all, when a client or patient calls to tell you that something's wrong, right? You always have to assess them. You can't assess them over the phone. So regardless, something's wrong, you're going to tell them to come in. Now look at this client who was already at... Let me see what she was. The client was already at lochia alba, right? White. Now she's gone back to rubra. R-U-B-R-A. I can't speak tonight. She's gone back to rubra. Guess what? She's bleeding out. It says here that she's saturating a pad every half hour. Let me tell you, the minute they're saturating a pad every hour, you're calling the physician, much less half hour. Okay, so they gave us a lot of signs to let us know that this patient's hemorrhaging. Okay, look how long after postpartum, 2 weeks. So she's gone from alba to that white, right? And she's supposed to go to no more to now rubra. And not only rubra, she's saturating those pads every half hour. That patient's bleeding out. You have to have them come in. You're going to be taking their blood pressure. You're going to be checking the H&H, the whole nine. Next question. A client's been receiving magnesium sulfate for severe preeclampsia for 12 hours. Her reflexes are 0 and her respiratory rate is 10. Which of the following situations could be a precipitating factor in these findings? 1, apical heart rate of 104. 2, urinary output of 240 cc's per 12 hours. 3, blood pressure of 160/120. Or D, temperature 100 degrees. And guys, the correct answer is 2, the urinary output of 240. It's been 12 hours, 12 times 3, that's your 360. She should be at least giving an output of 360. So if she's not, you want to know what that means? The kidney function has gone down. Urine output has gone down. Guess what? Toxicity has gone up. Here that patient is getting magnesium sulfate and she's not getting rid of it. because she's supposed to be excreting it from the body. Well, look, the urine output's down. She's not getting it out of her body, so it's building up in the body. What does magnesium sulfate does? It's a muscle relaxant. It relaxes the vessels as well. So what do you think's happening here? Look at these vitals, guys. Look at what it says. Her reflexes are 0. Guess what? She has such a high amount of that magnesium in her body. It's now 0, and it's supposed to be 2. Normal is 2, by the way. Respiratory rate is 10. It should be at least 12 to 22 or 24, depending on the book that you're using, but never 10. Why? Why are they so low? Because the magnesium sulfate has built up in her body. Magnesium sulfate is a muscle relaxant. It dilates the vessels, okay? It brings blood pressure down. Now, we never use it as an antihypertensive because we have so many other better things on the market for that. We don't use it specifically for that, but that is a side effect that you need to be watching out for. So, of course, if the kidney function's down, the patient's not urinating the way they should, the magnesium going to stay in their body more, and you're going to see those side effects such as the decreased reflexes, decreased respirations. You may even see decreased blood pressure below what it should be, okay? So the urinary output being decreased, that's probably what precipitated all those adverse effects that we just looked at. Next question. A client received general anesthesia during her C-section 4 hours ago. Which of the following postpartum nursing interventions is important for the nurse to make? 1, place the client flat in bed. 2, assess for dependent edema. 3, auscultate the lung fields. Or 4, check patellar reflexes. The correct answer, guys, is 3, auscultate the lung fields. What is a C-section? Surgery. They cut her open to get the baby. That's surgery. Now, what did I teach you guys? I don't care what kind of surgery this patient has. What are we always concerned about? 1, infection, such as pneumonia, right? 2, what's our second worry? What's our second concern? The patient developing a DVT, or that DVT starts to move, that clot starts moving, and it turns into what? An embolism. More specifically, what kind of embolism? A pulmonary embolism. It going to the patient's lungs. Thirdly, after surgery, we don't care what kind of surgery, including C-section, we're concerned about bleeding, that patient bleeding out, okay? So we're going to auscultate the lung fields. We want to hear the lung sounds, make sure that those lungs are expanded. We want to make sure that it's clear. Next question. The nurse is developing a standard care plan for the post-C-section client. Which of the following should the nurse plan to implement? 1, maintain the client in left lateral recumbent position. 2, teach sitz bath on second post-op day. 3, perform active range of motion exercises until ambulating. Or 4, assess central venous pressure during the first post-op day. And I hope you guys chose 3 because I literally just gave you the answer. Perform active range of motion exercises until ambulating. Why passive range of motion? Why do we care about ambulating? Guess what, guys? Until that patient is moving around. If they're not getting range of motion exercises, they're just sitting there. The blood is just sitting there. What happens when blood is just sitting there? Guess what? They start to clot. Whenever blood is not moving, you're not moving, everything's not moving, the blood is just sitting there and pooling, it starts to clot. The patient's at risk of getting what? A DVT. Even worse, that DVT starts moving and goes to the lungs, and the patient gets a pulmonary embolism. Okay? We want that patient moving around. I don't care what kind of surgery patient has. If a patient has surgery, those are the 3 things that need to be coming to your mind immediately. You want to prevent infection. You want to prevent bleeding. And you want to prevent DVT or pulmonary embolism. Okay, I hope I drilled that into your head. The nurse has administered Benadryl to a post-C-section client who's experiencing side effects from the parental morphine sulfate that was administered 30 minutes ago. Which of the following actions should the nurse perform following the administration of the drug? 1. Monitor the urine output hourly. 2. Supervise while the woman holds her newborn. 3. Position the woman slightly elevated on her left side. Or 4. Ask any visitors to leave the room. And the correct answer, guys, is 2. Supervise while the woman holds her newborn. Benadryl. What kind of med is that? It's an antihistamine, right? What is a common side effect of antihistamines? Drowsiness. Drowsiness. So you, the nurse, just gave this patient Benadryl, and you're going to let them hold the baby and just walk out the room? No. You're going to sit there and watch while they hold the baby because you want to make sure she doesn't get drowsy and drop the newborn. Next question. The nurse should expect to observe which behavior in a 3-week multigravida postpartum client with postpartum depression? 1. Feelings of infanticide. 2. Difficulty with breastfeeding latch. 3. Feelings of failure as a mother. 4. Concerns about sibling jealousy. And I'll give you a moment to think of your answer. The correct answer is 3. Feelings of a failure as a mother. Now, guys, if you already watched my video I did a psych video on depression, you would have gotten this right. You should have gotten this right. I will be mad at you if you don't. Why? Because you guys learned that depression is what? It's anger, hostility, resentment. All of that turned towards who? The self. Okay? I'm so dumb. I can't do anything right. Nobody likes me. Something's wrong with me. I'm a failure. It's anger. All of those horrible feelings, but it's turned inwards towards self. Okay? So yes, the mom with postpartum depression, you may expect them to have feelings of failure as a mother. They have those feelings towards themselves. Okay? A breastfeeding woman calls the pediatric nurse with the following complaint. I woke up this morning with a terrible cold. I don't want my baby to get sick. Which kind of formula should I give the baby until I get better? Which of the following replies by the nurse is appropriate at this time? 1. Any formula brand is satisfactory, but it is essential that it be mixed with water that has been boiled for at least 5 minutes. 2. Don't forget to pump your breast every 3 hours while you're feeding the baby the prescribed formula. 3. The best way to keep your baby from getting sick is for you to keep breastfeeding him rather than switching to formula. 4. In addition to feeding the baby formula, you should wear a surgical face mask when you are around him. And I'll give you a moment to think of your answer. The correct answer is 3, guys. The best way to keep your baby from getting sick is for you to keep breastfeeding him rather than switching to formula. Guys, the breast milk has so many antibodies, okay? That is the best thing that mom can be doing for that baby. And studies have shown time after time after time again, if moms were taught just how beneficial their breast milk is to the baby, they would have fed the baby breast milk instead of formula. And here's why the other answers are wrong. I want you to think about it, guys. Okay, you have a cold and you want to switch to formula and not breastfeed. But you're going to be feeding the baby the formula anyway, so the baby's still going to be exposed to you. So isn't it better that that baby's exposed to you while you're breastfeeding, but at least they're getting the antibodies, right? Instead of them being exposed to you and your cold, and you're giving them commercial formula, and they're not getting any antibodies. It only makes sense. You're going to expose yourself to the baby either way. Give them those antibodies, give them those vitamins, give them all the nutrition and the minerals that are found in your breast milk. Give it to the baby. It makes sense. So you're going to teach the mom to keep breastfeeding the baby. That is the best thing that she can do. A client who wishes to breastfeed advises the nurse that she had a breast reduction 1 year earlier. Which of the following responses by the nurse is appropriate? 1. Advise the woman that unfortunately she will be unable to breastfeed. 2. Examine the woman's breast to see where the incision was placed. 3. Monitor the baby's daily weights for excessive weight loss. 4. Inform the woman that reduction surgery rarely affects breast milk transfer. And the correct answer, guys, is 3. Monitor the baby's daily weights for excessive weight loss. Okay? Numbers don't lie, right? You need something subjective. So you're going to closely monitor that baby's weight, because what happens when the women get breast reductions, depending on the surgeon, how it's done, sometime that that gland, I'm trying to remember the name of it. Oh gosh. That mammary gland where the milk is produced, sometimes it's cut off. And so the baby won't be able to get the milk. But it just all depends on the kind of surgery the patient had. And guess what? That's not the nurse's business to try to find out what kind of surgery the patient had. The nurse's business is to find out if that baby is receiving the proper nutrition. And the only way to do that is to make sure you weigh the baby before they're fed and then weigh them after, pre and post feeding, okay? The proof is in the pudding. The numbers don't lie. If that baby's losing weight and mom's feeding, guess what? That baby's not getting the milk that they need, okay? Next question. The nurse is caring for a post-op C-section client. The woman is obese and is an insulin-dependent diabetic. For which of the following complications should the nurse carefully monitor this client? 1. Ineffective lactogenesis. 2. Dysfunctional parenting. 3. Wound dehiscence. Or 4. Projectile vomiting. And the correct answer is 3, wound dehiscence. Patients who have a wound dehiscence are at risk for what? Infection, right? That wound is now open, right? So think about it. Any normal person, if they have wound dehiscence, they're at risk for infection. What about when they're diabetic? Just the fact that you're diabetic, that puts you at risk for infections and poor wound healing. Let me explain this to you. The reason diabetics are at risk for infection, their blood is full of what? Sugar. It's a sugary environment. Want to know what else loves sugary environments? Bacteria. So being diabetic alone is a risk factor for infection and poor wound healing. Okay, so now this patient who has dehiscence, they have an open wound, which is a risk within itself for infection, and they're diabetic. This is what you're going to be worried about. Okay. The nurse is discharging 4 Rh negative clients from the maternity unit. The nurse knows that further teaching is needed when the client who had which of the following deliveries asked why she had not received her ROGAM. 1. Abortion at 10 weeks. 2. Fetal demise at 24 weeks. 3. Birth of Rh negative twins at 35 weeks gestation. Or 4. Delivery of a 40-week gestation Rh positive baby. And the correct answer is 3, guys. Birth of Rh negative twins at 35 weeks gestation. She doesn't need the ROGAM. Those twins are what? Rh negative, right? First of all, if a mom's Rh positive, she'll never need ROGAM. She's good. ROGAM's only given to moms who are Rh negative. But look at the situation that we have here. Let's go through the wrong choices. 1, abortion at 10 weeks. Yes, you're going to give mom that RhoGAM because she had abortion. We don't know what that baby was. We don't know if that baby was Rh negative or Rh positive, and we're not going to take that chance. Because if that baby was Rh positive, yes, she had an abortion, but now her body is making antibodies against that Rh positive baby, right? If she becomes pregnant again and that baby's Rh positive, her body will literally attack that baby, the fetus that's growing inside of her. So yes, you had an abortion. We don't know what that baby was. You're getting Rh. You're getting RhoGAM, right? Next choice, fetal demise at 24 weeks. So it wasn't an abortion, but the fetus died in mom's womb at 24 weeks. We don't know if that fetus was Rh positive or Rh negative. We're not going to take that chance. If mom's Rh negative, she's getting RhoGAM. Choice 4, delivery at 40 weeks of a Rh positive baby. Mom's negative, baby's positive, she's getting RhoGAM. Because if mom is negative and she gets pregnant with a Rh positive baby, her body will produce antibodies against the circulatory system of the fetus, and we cannot take that chance. So that's why 3 is the correct answer. So you have to do further teaching. You have to say to mom, yes, you're Rh negative, but the baby's Rh negative as well. So there's no need. It's not necessary for you to get the RhoGAM. In which of the following situations should a nurse report a possible DVT, even when the woman has a negative Homan sign? 1, the woman complains of numbness in toes and heel of one foot. 2, the woman has cramping pain in calf that's relieved when the foot's dorsiflexed. 3, one of the woman's calves is red, swollen, and warm to touch. 4, the veins in the ankle of one of the woman's legs are spider-like and purple. All right, guys, the correct answer is 3. One of the woman's calves is swollen, red, and warm to the touch. Warmth, redness, swelling, that's unilateral. You better be thinking DVT, okay? That's exactly what, I'm not going to say we're going to diagnose it because we're not doctor. We're not going to play doctor, but that's what you should suspect it to be, a DVT. A woman, 26 weeks gestation, has just delivered a fetal demise. Which of the following nursing actions is appropriate at this time? 1, remind the mother that she'll be able to have another baby in the future. 2, dress the baby in a t-shirt and swaddle the baby in a receiving blanket. 3, ask the woman if she'd like the doctor to prescribe a sedative for her. 4, remove the baby from the delivery room as soon as possible. And the correct answer is 2, dress the baby in a t-shirt and swaddle the baby in a receiving blanket. So yes, that baby's not alive. But guess what? That baby still has value to mom and dad. Mom and dad still had hopes and dreams and plans and ideas for that baby. Okay, so you're going to treat that baby with dignity and respect and dress that baby as you would a live infant, swaddle that baby as you would a live infant, and ask mom and dad if they'd like to hold the baby. And usually they do, okay? Because when you have a baby that dies, even if it's a newborn, that's something that you have to be able to process. And so usually parents want to say goodbye. They want to hold their baby, and they even want to name the baby, and you have to allow them to do that. Sometimes they want to have the chaplain come in, say a prayer. They'll want to make funeral arrangements. You have to allow them to do that because that's all part of the grieving process. You don't rush that baby out. You allow them. You give them that opportunity, okay? A client's postpartum 24 hours from a spontaneous vaginal delivery with rupture of the membranes for 42 hours. Which of the following signs and symptoms should the nurse report to the healthcare provider? 1, foul-smelling lochia. 2, engorged breasts. 3, cracked nipples. 4, cluster of hemorrhoids. The correct answer is 1, foul-smelling lochia. Guys, this is a sign and symptom of infection, endometriosis. Okay? All of the other choices, 2, the engorged breast, 3, the cracked nipples, 4, the cluster of hemorrhoids, all of that, I mean, they're problems, but there's teachings you could do with the patient regarding that. But what you need to call the doctor immediately about is infection, okay? Why? That puts the patient's physiological integrity at risk. Next question. A client 36 hours post C-section. Which of the following assessments would indicate that the client may have a paralytic ileus? 1, abdominal striae. 2, oliguria. 3, I can't even say that word. Amphalocele. D, absent bowel sounds. And the correct answer is D, absent bowel sounds. So what's paralytic ileus? That's when there's no peristalsis, there's no movement in that gut. You know how your GI tract is supposed to go like this, and it pushes all the feces along until it comes out the rectum, right? When there's paralytic ileus, there is no peristalsis at all. There's no feces moving, nothing. So you would expect when you listen to the bowel sounds for them to be absent. There shouldn't be any bowel sounds because there's nothing going on. There's nothing moving. By the way, guys, with a paralytic ileus, that's something that has to be corrected right away, right? So you're going to, that patient's going to be placed on NPO because you're expecting them to go into surgery. And whenever that patient's placed on NPO, what you're going to be doing, you're going to be making sure that that stomach's decompressed. So that patient's also going to be on an NG tube. We want that stomach decompressed because something we don't want that patient starting to get are stress ulcers, okay? A nurse is working on the postpartum unit. Which of the following patients should the nurse assess first? 1, PP1 from vaginal delivery, complains of burning on urination. 2, PP1 from forceps delivery with blood loss of 500 mL at the time of delivery. 3, PP3 from vacuum delivery with hemoglobin of 7.2. Or 4, P03, from C-section delivery, complains of firm and painful breasts. Now I'll give you a moment to think of your answer. And the correct answer is 3, the PP3 from vacuum delivery with a hemoglobin of 7.2. 7.2, yeah, she's probably going to need a blood transfusion. Okay, the normal is 12 to 15. Look how low that hemoglobin is. That patient's lost a lot of blood, and it has to be corrected immediately. Oh my goodness, I'm starting to run out of time. All right, next question. The nurse has administered methergine to 0.2 milligrams by mouth to a grand multipara who delivered vaginally 30 minutes earlier. Which of the following outcome indicates that the medication is effective? 1, the blood pressure is 120/80. 2, the pulse rate's 80 beats per minute and regular. 3, the fundus is firm at umbilicus. Or 4, increase in prothrombin time. And the correct answer is 3, fundus firm at the umbilicus. Now, guys, think about it. What is methergine? It's an oxytocic agent. What does it cause? What does it cause? It causes contraction, muscle contraction. And this is a good thing for a patient that may have a soft or boggy uterus, right? Because if they have a soft or boggy uterus, what can that cause? Bleeding. Do we want that patient bleeding to death? No. So they get that oxytocin medication, and it causes uterine contraction. So that uterus is going to be firm instead of boggy. And that's what we want to see. So when that happens, we know that that medication is effective. And I'm hitting my 30-minute mark. Okay, guys, last question. A postpartum woman has been diagnosed with postpartum psychosis. Which of the following signs and symptoms would the client exhibit? 1, hallucinations. 2, polyphagia. 3, induced vomiting. Or 4, weepy sadness. And the correct answer, guys, hallucinations. Okay? postpartum psychosis. When you see that word psychosis, that means that that patient is no longer in touch with reality at all. Okay? So what happens is many times when the moms have postpartum psychosis, they are not in touch with reality. They have voices in their head telling them that their newborn baby that they're supposed to love to death, those voices tell them that the newborn baby is the devil. And if they don't kill that baby, that the baby is going to destroy the world. Okay? So they have many times they have command hallucinations that tell them, you must kill this baby. And let me tell you something. When patients have psychosis and they have those command hallucinations telling them to do something, whatever those voices are telling them to do, they feel compelled to do it. They feel like they have no choice in the matter. They have to do whatever the voices tell them to do. Okay? So that mom that has postpartum psychosis is out of touch with reality. They are having hallucinations. Guys, I hope this video was helpful. I promise I have more maternity coming because all I did was high-risk postpartum, and I have more high-risk postpartum, not to even mention antepartum. So I have a lot of maternity for you coming, guys. I hope you guys enjoyed this video. Please, guys, if you want to support this channel and keep them coming, please don't forget to subscribe to my channel. Don't forget, if you like this video, make sure you like. If you like this video, don't forget to press that like button. And please share this video with anyone you know. If they're struggling with maternity, they're struggling with peds, any subjects that you know they need help with, go ahead and forward my video. Guys, thank you so much for joining me, and I'll see you next time.